Welcome to Navigating Insurance Coverage for Mental Health and Substance Use Treatment. This is Francis. Francis is a trained peer recovery coach. As a peer recovery coach, he helps people who need substance use disorder or mental health services. Let's watch Francis help people experiencing challenges with their insurance coverage. Rose is an injured athlete. She became dependent upon pain medications prescribed to her by her doctor. Rose tells Francis she needs help now. Francis gives her the resource guide for addiction and mental health care consumers. Francis tells Rose she should call the crisis line or the suicide line if it's an emergency. The crisis line is 1-844-711-HELP. Rose doesn't feel she's in crisis, but knows she needs treatment now. Rose is unsure of where to go for treatment, so she opens the resource guide. She learns she can get help finding a provider by first calling her insurance company and then looking on the New Hampshire Treatment Locator site at www.nhtreatment.org. Rose calls her insurance company and asks for the name and telephone numbers of qualified providers who are in network. She also asks if her insurance company requires any pre-authorizations before she can receive treatment. Her insurance company tells Rose that she needs to have an evaluation at her local health center before she can begin treatment. Francis drives Rose to the local center for her evaluation. Rose receives an evaluation and is connected to the services she needs. While Rose is being evaluated, Francis meets Astor in the waiting room of the health center and identifies himself as a peer recovery coach. Astor tells Francis he recently lost his job and his coverage. He's been struggling with severe depression, chronic alcohol use, and withdrawal symptoms. Astor's worried he won't get help because he doesn't have insurance. Francis suggests Astor ask if there are trained staff at the health center who can help figure out what insurance might be available to him. Francis also recommends Astor look at other options on www.healthcare.gov. Astor enrolls in an insurance plan and is approved for an inpatient residential treatment program. Astor successfully completes his inpatient program and is on the road to recovery. All of his providers recommend outpatient services as the next step. Astor's upset to learn his treatment is denied by his health insurance company. This means his insurance company will not pay for the ongoing treatment he needs to maintain recovery. Astor reaches out to Francis, who tells Astor not to give up and not to take no for an answer. Astor has a right to fair insurance coverage. By using the resource guide, Astor can work with his provider to navigate the appeal process so that he can access the treatment he needs. Francis recommends that Astor call his insurance company and ask the following questions. Why was I denied? How do I appeal? How much time do I have to appeal? Can I have a copy of my denial letter? Francis explains there are several types of appeals, also known as reviews. An internal appeal is a review by your insurance company. An external appeal is a review through the New Hampshire Insurance Department. Both types of appeals can be expedited. Astor knows he wants to appeal but needs a decision quickly. Astor's provider thinks he needs help now and is at risk for a relapse without the outpatient treatment. Francis explains to Astor that he can ask for an appeal for any reason. Astor can also ask for it to be expedited. With an expedited appeal, a decision must be made within 72 hours. Francis encourages Astor to discuss the denial with his provider. For an expedited appeal, his provider must certify that his life and health are in danger if he doesn't stay in the recommended outpatient treatment. Because Astor needs treatment right away, Astor and his provider use the resource guide to find out more about the appeal process. Astor and his provider call the New Hampshire Insurance Department to find out how to quickly file an expedited appeal and the required appeal documents. They call to inform the insurance company that Astor is seeking an expedited appeal immediately. The provider talks with the insurance company and explains the medical reasons for the treatment. Astor and his provider file documents as instructed. Although Astor was worried about his expedited review, his insurance company decided to cover the outpatient treatment with the help of his provider. He was able to continue receiving the services he needed to maintain his recovery. Continuing his work as a peer recovery coach, Francis educates groups about all types of appeals. Francis talks about how to appeal a denial if you're not in an emergency and you do not need an expedited review. He outlines the steps to follow to file an internal appeal. Your provider should call the insurance company to try to clear up any misunderstandings about your need for treatment or services. Write an internal appeal request letter by filling out Form 2 located in the resource guide. Include an explanation by your provider about why you need treatment and send it in. You should hear back from your insurance company within 30 days. Francis encourages people not to give up. He explains the steps to take if an internal review is denied. Follow the detailed instructions in the resource guide to successfully file an external appeal. File an external appeal with the New Hampshire Insurance Department within 180 days of the date of your denial letter. Make sure you have your denial letter from your health insurance company. Get help from the New Hampshire Insurance Department Consumer Hotline, your provider, or an advocate if you need help with your appeal. For more information about appeals and your right to fair insurance coverage, please see the resource guide available at www.new-futures.org/navigating treatment guide. Remember, help is available so that you can receive the healthcare coverage you're entitled to in order to continue on your path to treatment and recovery.